Hey everyone, and welcome to Laner. I am so incredibly thrilled you're here with us today. So be honest, do you remember the very first time you looked at an EKG strip as a nursing student? It probably felt like you were trying to read some sort of ancient hieroglyphics, right? Well, you are absolutely not alone in that. It can be super intimidating. But today, we're going to transform that mystery into complete mastery. We're taking a really structured, energetic, purely clinical approach to breaking down these strips. By the end of this explainer, you're going to see exactly how a simple checklist turns a bunch of chaotic squiggly lines into a really confident diagnosis. Let's get to work. Now, right off the bat, I want to highlight where our fantastic source material is coming from today, and that is Complete RN Solutions. Their whole mission is literally right there in their motto: empowering nurses, advancing careers. They put together some incredibly comprehensive nursing education, covering everything from NCLEX prep to exactly what we're focusing on right now, expert-level EKG courses. Having a source that is just so dedicated to clinical excellence really does make learning these highly technical topics a breeze. All right, let's jump right in. I want you to step fully into the role of a clinician with me for a second. Imagine you're at the nurse's station, or maybe you just walked into your patient's room, and someone hands you a fresh EKG tracing. The million-dollar question we have to answer is, can you identify this rhythm? We're not going to just guess, and we're definitely not jumping to conclusions based on a gut feeling. We're going to let the hard data tell us the whole story. Take a look at this. This is our raw, unidentified EKG strip straight from the source file. Just kind of absorb it for a second. You probably feel that instinct to try and solve the whole thing at a glance, right? I mean, you can see the big repeating spikes, the smaller waves rolling in between, the grid paper, but trying to take in the whole picture at once is honestly just overwhelming. To really solve this clinical mystery, we can't just stare at it and hope the answer magically appears. So to strip away all that confusion, we're going to use a strict 4-step checklist. Step 1, rate. Step 2, rhythm. Step 3, P waves. And step 4, intervals. Running every strip through this exact filter is the secret. So let's start with step 1. Okay, starting with the rate. Now remember, we don't just look at one generalized number, we actually have to look at both the top and the bottom chambers of the heart. Based on our source data for this specific strip, we have an atrial rate of exactly 70, and right next to it, a ventricular rate of exactly 70. They are perfectly matched, firing in total harmony at 70 beats per minute. Clinically speaking, this is huge. It tells us the electrical signal is starting at the top of the heart and being successfully received by the bottom, with no rogue pacemakers trying to hijack the system. Moving smoothly right into step 2, the rhythm itself. Is it chaotic or is it totally predictable? Well, our findings show that the atrial rhythm is regular, and the ventricular rhythm also completely regular. The distance from one beat to the next is just beautifully consistent. This level of consistency completely rules out chaotic arrhythmias like AFib right out of the gate. So we've got matching rates, perfectly regular rhythms. We are setting a really strong baseline for a healthy heart here. Okay. Now for what is always my absolute favorite part of the analysis, the P waves. This tells us what is actually kicking off the heartbeat. The P waves on our tracing are upright and they're nicely rounded. That is exactly the healthy standard shape we are looking for. Plus, the source specifically notes there is exactly one P wave for every single QRS complex. It's literally like a perfect dance routine. The top of the heart leads, the bottom follows, flawless 1-to-1 ratio every single time. No extra steps, no missed beats, just total synchronization. Let's see how our specific intervals measure up. This is where we really get into the precise split-second timing of the heart's electrical signals. We're looking at two crucial measurements here. First, the PR interval is clocked at 0.16 seconds. That falls perfectly right into the healthy 0.12 to 0.20 range, which means the signal is traveling down to the ventricles at a totally healthy, unobstructed speed. Next, the QRS duration, that big sharp spike. Our data shows a super tight 0.04 seconds. That is well under the 0.12 threshold that would warn us about a block or delayed conduction. Both of these numbers give us hard, quantifiable proof of really fast, healthy electrical pathways. And to completely finish out our interval checklist, we've got one more number to look at, the QT interval. Our source value here is 0.44. This is basically the total time it takes for the ventricles to depolarize and then totally reset themselves for the next beat. A measurement of 0.44 is a really solid, healthy repolarization time. And with that value established, boom, we've successfully capped off our clinical methodology. We literally have all the numerical data we need. Finally, we just have to ask, are there any wildcards? Any dropped beats, weird elevations, or bizarre ectopic complexes hiding in there? The answer here is a definitive no. There are absolutely zero abnormalities outside of the parameters we just measured. Because there's nothing else complicating the picture, we've officially collected every single puzzle piece. We are totally ready to make our final diagnosis. Look at the original strip one more time, but I want you to synthesize all the data points we just collected. You now know that behind these lines, the rate is perfectly matched at 70. You know the rhythm is completely steady and regular. You can mentally confirm those upright, rounded P waves leading every single tight 0.04-second QRS complex. You aren't just looking at random squiggles anymore. You are looking at a thoroughly decoded clinical document. Normal sinus rhythm. Interpretation confirmed. You didn't guess. You methodically solved it. You used a totally structured approach to verify the rate, rhythm, morphology, and intervals, proving without a doubt that this heart is doing exactly what it's supposed to do. Learning to read EKGs with this kind of unwavering clinical confidence is an absolute game changer for your practice. You've taken a massive step toward mastery today just by walking through this explainer with us. And remember, if you like this video and would like to see more nursing educational videos, follow Complete RNS Solutions. But hey, before we go, I want to leave you with something to think about. Now that you can perfectly identify a healthy rhythm, how quickly do you think you'd be able to spot the subtle, hidden signs of a silent heart attack? Keep analyzing, keep learning, and I will see you on the next one.